now why confusion in government is not only tolerated but encouraged, I have learned a confused people can make no clear demands. For those that are on Medicare, you'll get even a better laugh at it. That's the famous writer John Steinbeck, whose books I was forced to read when I was a kid. If anybody else had to read The Red Pony, riveting. Like Medicare. And then my last slide to really describe Medicare is if you're not confused, you're not paying attention. And I really enjoy this little comic here. If you can't see, it says square box, round pizza, triangular slices. That kind of sums up what Medicare can be. Isn't Medicare fun? Yeah. So why do seniors need help with Medicare? Because it's confusing. And frankly, it is, as you'll find. And my goal today is that everyone here leaves not only with one thing that they learn new about Medicare, but just that you have a better understanding about Medicare. And a simple theme at any point of this to remember is all you really need to know about Medicare is my phone number. Because you just call me and we'll give you all the answers that you need.
What would that be, John?
You can get it. So this is a cartoon on, this is just the prescription Part D. And this is just to give you an image of how confusing it is. These terms, these all relate to one part of Medicare. And some of you may know some of these terms like copayment, credible coverage, formularies, tiered copayments, coverage gap, donut hole, Medigap, deductible, average wholesale pricing. You get my drift? There's a lot to know and that's just one part of Medicare. So what I'm going to do here is we're going to start talking about the parts of Medicare, how Medicare works, how you would kind of enroll and use the benefits as a Medicare recipient. The government, in all of its infinite wisdom, will send you this book every year. It's 120 pages that you would read to educate you and update you every year on the changes in Medicare. This is all the government gives you. They have a website. The website I actually think is very good. It's more helpful, I think, than this book. The other alternative is that you obviously call someone like me, and we can help you, obviously, and we cost nothing to do that. So what is Medicare? Medicare was created in 1965 under President Johnson. It's a federal program that offers health insurance to seniors over 65 and certain beneficiaries under the age of 65. The original Medicare had two parts, A and B, and a trivia point, the first Medicare recipient was none other than President Truman. Who can get Medicare? I just alluded to this quickly. You have to be a citizen of the United States, a legal resident, and you must, this is kind of a quirky thing, but you must reside here for 5 years prior to joining Medicare. We can get into it another time, but obviously if you lived out of the country and you had Medicare, how do you access benefits when there aren't Medicare providers, say in Cuba or Venezuela or wherever you choose to live? So it doesn't make sense that you would go on Medicare. People under 65, if you have a disability, can qualify, and sadly for those individuals that face end-stage renal disease or Lou Gehrig's, they also automatically qualify for Medicare. So what does Medicare cover? We're going to get into the actual nuts and bolts of Medicare. So Part A is going to be what I usually call a continuum of care. It's going to be your hospital, your skilled nursing, your home, and then hospice. Those are the 4 parts of Part A. And with that, technically, we'll get into it later, but without buying any supplemental or additional coverage, if you had an incident where you went in a hospital, you would pay $1,364 upon admission into the hospital, and that would cover you for a 60-day window that you could go in and out of the hospital on that 60-day window. The reason I point this out is if in 90 days later you went back to the hospital, you would be again responsible for $1,364. The reason I point that out is that's not like current health insurance where we all have an annual deductible, say. This is per what they call benefit period. For most of us in this room, if you're working or your spouse has worked at least 10 years or 40 quarters and they don't have to be consecutive, you get A for free. There's no premium for Part A. Okay? I alluded to, some people might know payroll. It's a 2.9% total tax, 1.45 paid by us, 1.45 paid by our employer. What does Part B cover? So Part B is going to be everything that I didn't mention in Part A. So doctor visits, diagnostics, labs, durable medical equipment, ambulance services. Now the interesting thing with Part B is there is a premium for Part B. So when you retire or when you decide that you're going to go on Medicare, when you elect for Part B, you will be responsible to pay a monthly premium to the government every month that you want to keep your Part B active. For 2019, that premium is $135.50. And that's the baseline premium if you as an individual make less than $85,000, or if as a husband and wife or someone who files jointly under $170,000. So if I'm an individual, I make under 85, I pay $135.50. If I'm married or I file jointly, we're under 170, I pay $135 each. If you make over $320,000, for example, your premium could be as much as $468 for that same Part B. It's called IRMA. I don't want to get distracted from it, but don't be shell-shocked if you get a notice when you enroll in Medicare that your Part B is more than $135.50. And there is a deductible for Part B. It's a whopping $185, and for those that might be concerned, last year it was $183. So it's not something that moves at a big pace, but it does move. And the Part B premium for 2018 was $134, so a $1.50 increase. Part D, now I'm going over the basics of Medicare, A, B, and D, because these are what you need to understand are the true basics of Medicare. So Part D, as we all probably know, is drugs. D, this is the prescription drug plan. 2006 started under the Bush administration. Also under 2006, the bill enacted Medicare Advantage, which we'll talk about in a minute. But as far as Part D goes, there's two ways that you can get your Part D coverage. One is on what's called a standalone plan, which you would go to a provider and purchase that plan directly. The other option is you get it as a bundled package with your Medicare Advantage program. Something to know that's very important, and I'll mention it again later, is that if you do not enroll in Part D at the right time, you will face a lifetime penalty. Okay? Lifetime penalty. And also with Part B, we'll talk about you also, if you don't enroll in time, can face a lifetime penalty. The bottom line with Medicare, as you're going to find after this presentation, is that if you play by the rules, you have no problems. If you try to game the system, it's going to cost you in the end. So the one thing that I want to make sure I highlight, because everybody has questions on Part D, is the famed donut hole. And the reason they call it a donut hole, I'm just going to step away from the mic for a second, is that you actually have coverage from the part, and you actually go an area where you lose coverage. And I'll explain in a second. And then you gain coverage again. That's why they use it as a donut hole. Doesn't mean that it's any kind of other, there's no other relationship. Obviously we all like food, but the donut hole is for that reason. And really what I want to discuss is there's a deductible. We all know what deductibles are. For 2019, it's $415 your plan could have. A $415 deductible. I mean, you pay the first $415 of drug cost. Then you get to what's called the initial coverage level. That's where you actually begin to share in cost with the insurance company. They will offset your costs. Your generic drugs could be, a few dollars and things like that. But the coverage gap, which is what everybody wants to talk about, that is the area where the design of these programs, the cost sharing is passed on to you as the member. Now this is 2018, so the numbers in that center are wrong. There is, I couldn't find one for 2019 yet, but that number is reduced down to 25% for both brand and generic drugs. That's a good thing. And the goal is by 2020, if legislation sticks, that the donut hole will be erased. So for people that are on heavier drugs, Forteo is one I helped a woman with the other day. It's $3,400 a month. To get in a donut hole, your drug cost is $3,820. So this woman, after 1 month, goes in that donut hole. She'll spend about $1,280 of cost in that window. But when she leaves and goes into the catastrophic, she only pays 5% of her drug cost. So there is kind of relief on the back end of the way that the Part D works. If they eliminate the donut hole, I think it would just be easier for people to understand, regardless of the cost. I think the goal of it is people would just understand, here's what my drugs cost kind of every month. They would be able to project out budget-wise. I just want to stop right there. Does anybody have, I can spend time here. I don't want to take too much time because I know I'm limited, but does anybody have specific questions about donut hole? Because I know we spend a lot of time helping our clients on it. Anyone? And again, I'll take questions at the end or during the presentation, so please don't be shy. So what are my options for Medicare? Now that we understand there's Part A, there's Part B, and Part D, you go, now how do I go from here? What do I do? Well, there's two options. On the left-hand side is what we call original Medicare. That means that you would be enrolled in A and B as your primary insurance. Then you would purchase a Medicare supplement and a standalone prescription drug plan. So as confusing as it sounds, you would have 3 cards. That would be your health care, 3 cards. If you chose Medicare Advantage on the right-hand side, you would still have your A and B Medicare. However, you would purchase a plan with Medicare Advantage by a private health insurance company, and they would give you benefits for A, B, and D. All wrapped up, you need just 1 card for that. And I'll explain how it works in a little more detail here. So if we went down the left-hand side, we know what A and B is. So what would happen is if I go to a doctor, the first thing I need to do under original Medicare, and this is important that you understand this, under original Medicare, is I call a provider. I'll call Dr. Peggy, and I say, Dr. Peggy, do you accept Medicare? If she says yes, I can see her. And then she has to, by law, accept my Medicare supplement no matter what company it is. Okay, no matter what company, whether it's fly-by-night insurance, a national brand, United Healthcare, Aetna, they have to, by law, take your Medicare supplement. An important thing to understand about what original Medicare allows people is that I live here in Fairfax, obviously Fairfax County. I could call the Mayo Clinic on original Medicare and say, hi, do you take Medicare? Cool. I call a doctor. I can actually make an appointment at the Mayo Clinic and see them, hand them my red, white, and blue card, hand them my Medicare supplement card, and I have health care. Okay, that's one of the big deals with seniors as we age. A lot of seniors want to be in control of their health care benefits, and original Medicare is the program that will allow you to have the freedom of choice to see any doctor that you choose. Again, to receive benefits, they have to participate with Medicare. Go ahead.
A lot of my clients are moving, moving between states, yep. And they're definitely afraid that their Medicare will change if they move to a different state. Do you handle, for example, Florida, North Carolina? Okay, so you can help explain that to them. Or maybe
and I was going to allude to this later in the presentation about what's called, we'll talk about enrollment periods if I'll get to it in a minute, but that's called the special enrollment period, the SEP. When you move, your A and B stays consistent. You just, where you file your Medicare supplement, purchase your Medicare supplement would change. I'll explain that if you can give me a couple slides. But great question, go ahead.
So where there says Medicare supplement, so some people buy their supplemental insurance from Medicare and other people buy it from a private agency?
No.
Okay.
But good question. So Medicare A and B is from the government. That is your primary. The business of Medicare supplement is only with insurance companies. They don't have to be a health insurance company. For example, a name that we all know, I knew as a kid, I used to Sunday nights watch it by the fireplace, Mutual Omaha's Wild Kingdom. Mutual Omaha is an insurance company that provides Medicare supplement. You understand what I'm saying? But Aetna is a health insurance company, United Healthcare are health insurance companies that also provide Medicare supplement, but you don't have to be a health insurance company to do Medicare supplement. But you would make a payment to that private company.
And what is Medigap?
That's the same thing.
Okay.
It's another term for Medicare supplement.
Okay.
Just a way to confuse you. Go ahead.
I just wanted to throw out, my mother's over, happens to be at a Sunrise facility, and they have their own Advantage plan, so there are other groups getting in on the
Advantage
AO plans as well.
They have a plan called AO, I can talk all day, AOC, Accountable Care Organization, where they actually have built their own network of providers and benefits for Medicare Advantage that has to meet or exceed Medicare benefits. Yeah, there are more and more companies getting a Medicare Advantage. I'll talk about that in a second. So on original Medicare, you have your original Medicare. That's what you would hand the doctor as your first primary benefit. And then your second card would be your Medicare supplement. The third part of that is that you would buy a prescription drug plan. Again, your Medicare supplement doesn't have to be the same as your prescription drug plan. But you would buy a prescription drug, and then your Medicare would be complete, meaning that you have A and B, you have a supplement, and you have prescription. That is all the health care that you would need if you choose on that side of the equation. Medicare Advantage, now I'm going to spend a couple minutes here because I really want to make sure people understand how this works and maybe potentially why people would choose this as an option. If you choose to enroll in Medicare Advantage, and if you can't read it, it said your benefits will be administered by a private insurance company. The best way for you to understand this is if you enroll in Medicare Advantage, like this one was saying at Sunrise, that is your health insurance. Your A and B, while you still pay those premiums to the government, is gone. Nothing is ever billed for A and B. Your relationship becomes with that insurance company, and most of those plans will have a prescription drug benefit wrapped into it, so that you have one person, kind of like your health insurance under 65, one person or organization that coordinates all your care. Now let me explain how that works. This is kind of advanced economics. Does anybody, I've been in healthcare a long time, anybody know the word capitation? Or remember the word capitation? Capitation is when a health insurance company pays their doctors a fixed fee every month to manage their patients. So if Dr. Peggy has 1,000 patients and the insurance company wants to pay her $10 a month, they would send her a check for $10,000 every month, whether she saw one patient or all 1,000. Now I want you to remember that concept because that's how Medicare Advantage works. I pay my $135 to the government for my Part B. The government will in turn send a check to an insurance company, I think it's about $986 every month, to provide me their health benefits. Okay? So that's why you lose your A and B benefits, because the government takes your money and sends it to an insurance company and says, you deal with this person. Okay? So that's why you lose those benefits. Sometimes people go, well, I'll see these doctors under my HMO benefits, and I'll see another doctor and just bill A and B. You can't do that. You can't do that. So that's why there's a small word here, hold on. But if I go back here real quick, it's not big enough, but or. You have to pick one or the other. Okay? You have to pick either original Medicare or Medicare Advantage. You cannot have both. Go ahead, in the back.
So the Advantage is basically the managed care, but they're going to try and reduce the services until they really have to spend the money.
Yeah, I'll stop you right there. That's wrong. By CMS standards, Medicare Advantage must, and remember these words, meet or exceed original Medicare benefits. You cannot carve out, you cannot reduce, you cannot do anything that is below Medicare standards. And without getting into it, original Medicare, you get just health insurance. If you go on Medicare Advantage, you get silver sneakers, gym membership with most of the companies. You get dental, transportation, hearing aids, vision care, hearing checkups, which aren't covered under basic Medicare. So you get a more value-based system with Medicare Advantage. From dollars and cents, you definitely get more for your dollar with Medicare Advantage. But what you give up, obviously, the most important thing is your freedom of choice. And that, for a lot of people, is important as we age, that we want to have the freedom to pick our provider. Do you have a question, Paul?
Yeah, some of the, I understand some of the Medicare programs cover 80% of your cost, and then you have to pay 20%, while others, once you hit your deductible, it's 100% coverage. Is that correct?
Yes and no. So with Medicare Supplement, to go back right here, Medicare Supplement, to confuse you further, there's letters A, B, well, C is going away, F, G, N. Very confusion. Depending on what letter you buy, will answer Paul's question. So Part B, after you pay the $185, is an 80-20 cost shift. So if you had no other benefits, if I just decided I was going to get A and B and that's my health insurance, when I pay my $185, after that it's a straight 80-20 cost share with no limit. That's the scary part about Part B, no limit. So if someone gets on cancer therapies that are $50,000, $100,000 a month, you're responsible for 20% of that with no limit. It's kind of scary. So by buying a Medigap policy, Plan F, for example, wipes out all your out-of-pocket expenses. Plan G wipes out all but the $185. So there are ways to help you solve what your actual out-of-pocket cost would be. So that's a good question, Paul.
To follow up, if you choose Medicare Advantage, do you have the same option to eliminate that 20%?
Yes. So Medicare Advantage is like our health insurance that most of our are familiar with, whether you have a PPO, an HMO, point of service, where you're paying co-pays for your services. That's the exact same thing that happens with Medicare Advantage. So for example, the hospital that has the $1,364 admission, a lot of the HMO companies will make you pay $200 a day. So if you go in for one day, you only pay $200. But they would cap you, say, at 5 days or 6 days. But there is a way to help offset that cost. It's a good question. So what does Medicare cost? I'm just going to one more question. Go ahead.
The deductible for Part B, is it not divided into 3 parts, like doctors and services, then blood transfusion and durable.
And you are good. It is, you can reach your deductible in any of those three areas, but once you meet it in one, it covers all three. So what her question is, so you understand in Part B, there is $185. There's three ways that you are responsible for $185. Blood, 3 pints of blood, durable medical equipment, or any kind of diagnostic doctor care visits, any kind of just regular medical expenses. Once you spend that $185, so today's January 2nd, hypothetically I'm on Medicare, I go see a specialist for $500, I would pay $185, and I'm done for the year. If I need to buy a wheelchair today, I pay the first $185. After that, I'm paid for all of the year. Any other questions? Go ahead.
If your employer, like the federal government, provides you with insurance for life as part of your benefit, like Kaiser for some federal employees, how does that work with?
We'll get to that. If I can, we're almost there.
Okay.
Her question's about working past 65 or retiring at 65. We'll get to that. We'll get to that. How much time do I have total? Okay, I'm going fast. Medicare cost, I went through, A is free, B $135.50. Part D on average, I just want to give you an idea, Part D on average is $41.20. The good news in the state of Virginia is an awesome, I use that word, Virginia is an awesome Medicare state. I promise you living here is fantastic for Medicare. Our costs are amongst the lowest in our nation. Our Medicare supplement premiums rank about the 8th cheapest in the nation. You have a great state for Medicare. You should never complain about it. If you want to get miserable, move to Maryland. Honest. Medicare Part C, that's Medicare Advantage. On average, a full-blown HMO, I don't want to get into, there's PPOs, POSs, there's what's called a PFFS, there's MSA. I could confuse the heck out of you. $28. And the average Medigap plan for a person turning age 65 plan and is the cheapest you could buy one, approximately $75 a month. The difference between Plan C, which is Medicare Advantage, no matter what your age is, it's the same premium. So a 65-year-old could be $28, or could be at the plan, and so would a 95-year-old. Where a Medicare supplement, you're cheap at 65, you could be $75, but when you reach 85, it could be $125. It goes up with your age. Out-of-pocket cost, just to highlight, because people think Medicare is free. It's not. You could have co-payments, deductibles, and co-insurance, just like normal health insurance. And especially on Part D prescription drug, there is nothing that's free. There's nothing that's free. You could have a 90-day supply of a generic mail order. Short of that, you're going to pay something for every medication that you get. When can I enroll? So this is going to get into some of the questions I'm sure you have about, now we learned about what is Medicare, how much does it cost, and then how do I get it? So most Medicare enroll when you turn 65. This is what's called your IEP, your initial election period. It lasts 7 months. Bingo. So you get to enroll for A, B, and D, during 3 months prior to your birth month, the month of your birth month, and 3 months after. Understand that if you have a situation where you lose benefits at 65, if you wait 3 months after, you went 3 months without health insurance. So it's good to coordinate and know that you're going to enroll when you can get enrolled without any, couple things. There's no penalties during this window. You won't accumulate those magic penalties that I talked about if you do it in this window, as well as most programs will have no medical underwriting, meaning if you have pre-existing conditions, and I don't want to hear about it, but if you have them, they can't discriminate your enrollment during this period, okay? And that applies mostly for the Medicare supplement plan. Mostly for the Medicare Medicare Advantage has no medical underwriting, nor does Medicare prescription drug have any underwriting. So if you play by the rules and you enroll in this 7-month window, you can get parts A, B, and D. You avoid underwriting. And as this woman mentioned, I'll get into it in a second, but the special enrollment period outside of your IEP, the only other times you can enroll would be under what's called an SEP for a special enrollment period, and we'll get into that in a second. Just some good common sense when you're first eligible, be proactive. Make sure you know your IEP date. Okay, I'm September birthday. I will definitely remember that in September. I need to make sure I'm on Medicare when that time comes. If you're already on Social Security prior to 65, okay, if you're already on Social Security, they will automatically enroll you in A and B. If you are not, you have got to enroll on your own. So for people or friends of yours that think they're smart, oh, it's good, the government's going to send it to me. Nope. That's going to get a penalty. That's going to get a penalty. So you want to make sure that you're proactive in understanding your IEP. You can sign up online, which is great. You can sign up through the mail, or you can really do something awesome, which is go to Social Security and lose a day of your life. Kind of like DMV. If you work past 65, and this will bundle in what this woman asked about health insurance past 65, you still have an IEP. At 65, you probably would enroll in Part A. It's free. And if you work past 65 and you work for an employer over 20 employees, I'm just going to skip that second box there. If you work for a company over 20 employees, their benefits meet, trust me, they meet or exceed Medicare. You can stay on your employer benefits. They are your primary health plan. You elect for Part A because it's free. God forbid you go in the hospital while you're working past 65, the bill goes to the insurance company, then would go to Medicare. It's free. If you are under 20 lives, and if many of you are working for small companies and you don't remember anything but this today, at 65 you have to go on Medicare, no matter whether you like that decision or not. And let me explain the ramifications. Under 20 lives, Medicare automatically becomes your primary health insurance. That is not your vote. That is the government. By you foregoing that and saying, I have health insurance, a really terrible thing happens. You become an insurance company. You are your primary health insurance. Because even though I might have health insurance with my small group, they're secondary. So that 80%, that's you. Okay? I don't mean to scare people. I just make sure when I do my workshops that people understand that there are absolute things that you cannot do or make mistakes because you will pay dearly. Okay? And if you miss that enrollment window, Part B penalty is 10% of the premium every year the rest of your life. So, and then Part D, but you would be good with your Part D because your health insurance would be considered creditable. But I emphasize this because you cannot afford to make that mistake. Okay, a friend of mine had a guy who does health insurance, had a company, small company. The guy decided he didn't want to go on health insurance. He went to the hospital at 67 years old. He had health insurance. Did you know what his bill was? Not pretty. So you have to make sure you understand your rules. You'll have friends and you'll have people that will tell you, this is what I did. Every person in this room, your Medicare situation is unique to you. Do not follow anybody. Do not follow anybody. Okay? Everyone is unique. The special enrollment period, I want to explain that real quick. Under Medicare, if you move, and Medicare for a lot of people don't understand is filed by counties. So I could help a client that lived in Fairfax and retired here. That would be what's called a SEP because they moved. A plan in Fairfax County doesn't necessarily mean it's available in Loudoun County. So that individual could move to this building right here, the Ashley, call me, and I could put them in a brand new Medicare plan with no medical underwriting. Medicare Advantage, Medicare Supplement, Medicare Part D, whatever they wanted. We could put them in a brand new plan here. So if they're on Medicare Advantage in Fairfax, they move here, they want to be on Medicare Supplement, they can do that. If they're on Medicare Supplement, they want to move to Medicare Advantage, they can do that. Okay, no medical underwriting, that's 12 months of the year. They can't hold you hostage. They need to give you freedom of choice. Another very important note, COBRA past 65 is not considered credible. It will be just like your health insurance, and it will only pay the 20% as your secondary insurance. So I had a client call me the other day and said, I'm 67, I've been on COBRA. I went, ooh. And he has no A and B. Not good. But we'll help him. We'll get him through it, but that's not the way you want to plan for your Medicare. Employer coverage, make sure you talk to your employer if they have an HR department. Make sure you get the facts. Make sure you get the facts. Especially under 20. I told you what you need to over 20, you still want to talk to them. To answer this woman's question, even federal governments, for example, the state of Maryland, when you retire, they force you to go on A and B. You have to go on A and B. Even though you work for a government and they're going to give you lifetime benefits, their benefits shift into the secondary position. That's what they're going to give you. The primary, which is Medicare A and B, you're going to have to pay for that. So don't assume that because you have retiree benefits that they're going to be the primary. You make sure you do your homework and talk to HR departments. When can you change the annual election period? Some of you know me from October 15th to December 7th. I lost all my hair. But that's when seniors make their changes. That's the open enrollment period, kind of like a lot of you have with health insurance. That's the craziest time of year. You can change your prescription. You change everything. That's a crazy time of year. New to this year, and I just want to explain this real quick, it's what's called, further to confuse you with terms, it's called OEP, Open Enrollment Period. January 1st to March 31st, so right now, if you are currently on Medicare Advantage and only Medicare Advantage, you can continue to change from Medicare Advantage to another Medicare Advantage plan, or you can actually leave Medicare Advantage and go back to original Medicare from March 1st to, or January 1st to March 31st. That's when you're allowed to do that.
And who do you do that with? Do you do it with your insurance company, or do you go through the government?
Depends on what change you're making. Your A and B, you're still paying your premiums.
Yeah.
If you want to change from Medicare to get Medicare Advantage, you can do one of two things. You can call the new company you want to enroll with, and they can handle the enrollment, or you can call an agent like us. We can do the same service. When changing, I don't really need, no one here really probably needs my advice on changing if you're not on Medicare. Budgets, I gave you the numbers. How do I choose? I'll leave you with this because I know we're almost out of time. Be an individual and be proactive in your health care. What you choose or your spouse choose can be two totally different plans, and it can work. Okay? I have people going, well, I've always had the same benefits as my spouse. That doesn't mean you should continue to have them. Things like your formularies on your drug lists are different. If I take a certain set of medications and my spouse takes a different sort of medications, I promise you, more than likely you'll be on different plans. It's okay. It's okay. Medicare can be confusing. Start early. Be proactive. We typically start with ours, when we get a referral to a client or we are introduced to somebody, our goal is 1 year. 64 is a great time to start. Worst case scenario, 6 months out. We will assist you in applying for A, applying for B. We will hold your hand through the whole process. We cost absolutely nothing. So we cost nothing to help you. When you get involved with Medicare, there are some things that you can do to familiarize yourself with it. Obviously, be proactive in learning about it, but ask questions. So, for example, a big thing we see with seniors when they get on Medicare is labs. So a senior goes into labs and they get their annual lab work and they just think, well, it's all covered. It's not. So you have to make sure you tell your provider, please run only tests covered by Medicare, unless you have a specific condition or something that you just need to be covered for. Or for example, the IOL, the intraocular lens, which is cataracts, right? You have to ask your provider if they take Medicare payment to include the laser, or is there an upcharge? Because basic Medicare only covers the knife, as it's actually written. So you have to ask questions. I want to be respectful of time, it's 9:36. I can take as many questions now, or if you want to see me at the end of the presentation, I can give you my business card. Our website is very helpful. It's an educational website. My website is not a sales website. It's a compliant educational website, meaning that you or your clients can go there and learn about Medicare. We've dummied down Medicare.gov to a layman's term so you can understand what you're doing. Kind of what goes step with what I've discussed today about learning about Medicare. I also have a book from United Healthcare. It's called Medicare Made Clear. It's a 50-page booklet that if you're a caregiver or care provider or someone that deals with Medicare, I promise you it's awesome. That's why I give it out. It's 50 pages. It's like a mini little resource book. Answer what happens if you work past 65. What's the donut hole? All the things I kind of went over today. It's awesome. I don't mind giving you a copy. They're free, and we'll make more. The last thing I'll say is if you or anybody in your organization you feel like would benefit from me coming in and help, we love to educate people. That's what I do every day of my life. I love to educate people on Medicare. So if you feel like there's some place that we can help, that's what we're here for. It's a new year. We can start fresh with everything. If you have looking for content at a meeting or someone that would benefit from learning about Medicare, just keep me in mind. Again, we don't charge anything. We would love to share our knowledge. Any questions? And if not, I'll...
Okay, so in light of Medicare supplements are more expensive, Medicare Advantage has vision, dental, hearing, all those other cool things. Why would you pay more? Could you explain that difference between?
Yeah. Actually, I can because it's an individual decision. And what I mean by that is someone might not have the budget to afford original Medicare with a Medicare supplement. Someone's doctors may not be in a Medicare Advantage network, which means they're forced to change their doctor. Formularies. A Medicare Advantage plan might not have a formulary that fits with your drugs, or the tiering of your drugs are such where the cheaper premium, your out-of-pocket cost when you look at co-payments could be exorbitant if it's not in a formulary or something. So there's a lot of homework that we do with our seniors to make sure that we properly plan and present to them all their options, and then let them make their decisions. There's no question about that.
Is there an out-of-pocket limit with Medicare Advantage?
Yep, that's a great question. So Medicare Advantage, the federal government set the limit at $6,700. That's your out-of-pocket expenses, not premium and not drug cost. Anything medical related, doctor co-pays, hospital co-pays. There are some 80-20 things like Part B infusion therapies and things like that. That would be under 20%. But $6,700 is your absolute out-of-pocket maximum that you would spend on Medicare. Another great question. Anything else? Go ahead.
Why are you penalized if you don't get it?
Because the concept of insurance is that the more people that pay in, you can drive your costs down. So it's just a cost sharing. So by not participating, they want to penalize you to make you go, well, I better play by their rules or else I'm going to be penalized.
So, my father actually just brought this up the other day. I think he's Medicare AB, but now that I'm listening, he might have switched to Advantage and I didn't know it. That happens all the time. So he said something about the Safeway he goes to is no longer taking the prescription insurance, so he's switching to CVS. Can you describe what that might be about?
Yeah, so Part D plans, just like any other managed care organization, they have a network of pharmacies. They have preferred pharmacies, they have what's called standard pharmacies, and then they have obviously non-participating pharmacies. If your pharmacy is not preferred, that's not the worst thing. That just means on a preferred pharmacy, you'll pay the lowest cost. If you go to a standard, you're just going to pay more, but you're still going to get coverage. It's when you go to a non-participating that you would pay that higher payment, and that's really why your father's being disincentivized to go to wherever, Safeway.
And is it true both for the option 1 and option 2? As far as Medicare, AB, buy the stuff separately versus
Part D, the design of it, which I just described, whether it's standalone or rolled into a Medicare Advantage, they will have preferred and standard pharmacies.
Okay.
CVS is probably the one that's the most common in every Part D plan. CVS is kind of the 800-pound behemoth in that business. They even have their own plan called Silver Scripts. So they're big. Any other questions?
All right, I have one.
Good. I'm going to start charging them. I'm just kidding.
I know. So back to the Advantage plan versus the Medicare. So it was a while that I worked in a nursing home a while ago. But on the business side, one of the issues were when people had insurance companies or Advantage plans, from a business perspective, it was just more difficult to be allowed to keep the people in the building as long. So I'm trying to decide, is that still the case?
Yeah.
They're popping up all over the place, and they're making it seem like that's what you should do.
Yeah, so it's an interesting, your question's awesome, and we could talk for a long time about many facets. I've been in healthcare since 1990, technically. I worked for George Washington Hospital 28 years ago. I've got a lot of knowledge on the inner workings at HMO and managed care, and your question on a lot of levels, but in a nutshell, they're a health insurance company. What are they used to doing? Managing healthcare, and obviously they have dollars and cents to answer, and most of them are publicly traded. We can go on and on.
Right.
But my point being sure, they will tell you that they brag about having shorter admission periods. Whether that's true or not, I don't know. You know what I'm saying? Whether it's valid that people just leave better because they're healthier, or do they kick them out? I don't know.
Right.
But I think Medicare Advantage, I can tell you that it's about a third of the enrollment in the country is in Medicare Advantage. About 20 to 60 million are on Medicare Advantage. Those plans are growing in popularity, and for many seniors, they work very well. They do work very well, but again,
Until they get sick.
right, you have freedom of choice, and that's what I said earlier about making your decisions. Make your decision, be comfortable with your decision, and you're empowered to make your decisions. Don't let anybody else influence you.
Medicare Advantage can also be coupled with Medicaid.
Yeah, that's a good question. So if you
Same
are...
thing with the supplement.
No, something can't be. So this gentleman asked about, in the state of Virginia, a lot of us know CCC Plus. So CCC Plus members can actually, they are enrolled in one of 6 managed care organizations automatically. That's what CCC Plus is: United, Aetna, Humana, Virginia Premier, and anyway. My point is, one of those 6 plans they're auto-enrolled in. That is their managed care. That is their CCC Plus Medicaid. Those seniors can also then enroll in another plan called a dual special needs plan, dual meaning Medicare, Medicaid, through an insurance company, United, Humana, Virginia Premier, anyway, that will layer on top of their CCC Plus to give them extra benefits, transportation, dental, vision, hearing aids, gym memberships, a product guide that they can purchase goods out of. So that's something that what I'm describing is only for dual specialties, and that's full dual. I mean, they're full Medicaid, full Medicare, not partial, not just LIS or not just extra help. But that's a good question. You have another question?
Oh, can you go out of state with Medicare Advantage?
Yeah, Medicare Advantage will cover you only out of state for emergencies and out of the country. Anywhere in the world you're covered for well, yeah, a lot of the plans will have what they have like an exchange program where if you go to Florida for 3 months, you notify them and they'll help you find a provider in your area that would be seen as a primary care doctor at co-pays that are some plans. It's morphing. I mean, Medicare Advantage is having to develop to meet the needs. There's no question about it. But that's a great question. Anyone else? In the back?
With the CCC Plus, I know in 19 they raised the veterans benefits and they were raising the income limits for the Medicaid. Do you know what it is for seniors now?
I don't. I know for a fact in 2018 it started Medicaid started as an individual $9,000. And then it depends on after that, are you married, do you have children, and it ratchets up from there. You have to have less than $2,000 of actual liquid assets, and then depending on if you're married, you can own a car, and you can still own a house and things like that, but it's, $9,000 is, it's rough.
But the CCC Plus is going to be covered under Medicare Advantage plans only, not
Yes.
Medicare.
Yes. Well, remember, Medicaid is a state-run program. So the state of Virginia has called their Medicaid CCC Plus, so that's run through them. Medicare is run through the federal government. The plans that you would buy from a private insurance company that I alluded to, the dual specialties, that basically layers in front of that. So it takes out the government from the federal government, and you really only work with the state Medicaid and that insurance company. And typically you can align those together. If your CCC Plus is United Healthcare, you can buy a dual specialty that's United Healthcare and kind of stay in that continuum of care.
So it's still indigent. There's still not a lot of help for the middle class.
Middle class, I can't really. I don't. What is the middle class? What is the middle? Yeah. No, you're absolutely right. I'm saying what is middle? It's seems like it's going away. But yes. Somebody else had a question.
No, once you enroll in either Medicare Advantage or Medicare Supplement, and you choose the insurance company to cover you, as long as you pay your premiums, are you on for life?
Yep. Yeah, you cannot be kicked off Medicare. If you pay your premiums, they cannot kick you off. So whether it's A and B or private health insurance.
Don't the premiums for Medicare just come out of Social Security pay?
You can opt for that. If not, you write a check. Every 3 months. A lot of people get confused. I get this call all the time. Yeah, I just enrolled for Medicare. I got a check. I got a bill for $403.50. How come so much? That's your first 3 months of Medicare Part B. They just paper bill you if you're not on Social Security.
One more quick one. A lot of my clients, at least, they travel out of the country now that they're retired. And they have Part A and B in a supplement. Does Medicare cover out of the country?
So Medicare Advantage covers accidents and emergencies anywhere in the world. If you buy Medicare Supplement, you'll get $50,000 of travel benefit at an 80-20 benefit with a $250 deductible. So for people that like to travel, most times, if they're heavy travelers, they'll go on Medicare, original Medicare, and purchase a supplement because it gives them a little bit more. Many of those people in that situation, I just tell them to buy travel health insurance if they're going to go for an extended period of time. Anyway, I'll stay around, obviously, answer any questions. I feel terrible we went long, but thank you so much. Happy New Year, everybody.
Thank you so much. That was really awesome. I know we could talk all day. I was very confused, so. All right, so we're going to do the door prize. John brought the door prize this year. Anyone who did not put in their business card, I'm just going to pass this around. Just pass it around. And we're going to do announcements and new people. So because we're short on time, be short when you